monitoring blood pressure. Hi, I'm Mikhail Holmes, and today I will explain to my audience on how to manually take blood pressure. There are times in life where we say, if we knew what we know now, then we have done things differently. For me, it's monitoring blood pressure. My father had issues with blood pressure that he suffered with for many years, and he did not understand how important it was to monitor it. He had an at-home monitoring system, but he seldom used it, and when he did it incorrectly. When I was 19, he passed from a massive heart attack. And I sometimes think if I had the knowledge that I have now, maybe I could have prevented his untimely death. I have been in the health field for 11 years, and I take blood pressure a lot, sometimes 50 times a day. I now use my knowledge to help my mother manage her blood pressure. And I know, like myself, many of you have family members and loved ones who struggle with high blood pressure issues. So today, with the help of Anatomy and Physiology, American Heart Association, Mayo Clinic, and WebMD, I will explain what blood pressure is, the components of taking blood pressure, and then demonstrate those steps to you. So, what is blood pressure? According to the 7th edition of Anatomy and Physiology, it is pressure as force exerted on vessel walls expressed in millimeters of mercury. That was simple, right? Well, just think of it as a pumping system. The heart is the pump, and the pressure on the pipes would be the blood pressure. Abnormally high pressure would be high blood pressure or hypertension. Just the opposite would be low blood pressure or hypotension. So I know some of you think as long as the heart is pumping blood, then what's the big deal? Well, high blood pressure can lead to heart attack, stroke, heart failure, and an aneurysm. Last month, the American Heart Association put out an article that states smoking, obesity, race, gender, and age are risk factors for high blood pressure. So let's shoot for low blood pressure, right? Well, according to the Mayo Clinic, hypotension can be just as detrimental as hypertension. When taking blood pressure, you want to make sure you have the proper equipment. Today, I'll be using a manual monitoring system that I use at work, which consists of a cuff and a stethoscope. When using a stethoscope, you want to make sure the earpiece are snugly in the ears. You want to use the larger end and not the smaller, and do not place your thumb over the smaller piece because it can pick up your pulse. Now, the components of the cuff are the cuff itself, the manometer, the bulb, and the valve. Now, the cuff has an indication area of where to place it on the arm. You want to line this up where the brachial artery is. If you're not familiar or you cannot find that, use your 2 fingers, place it on the area, and you should feel a pulse. At that moment, that's where you know where to place the cuff. You want to make sure that you use the proper size of cuff because that can alter the results. You now have the valve and the bulb. When inflating the cuff, you want to close the valve and squeeze on the bulb. When you deflate the cuff, you want to open up the valve. What you're listening for with the stethoscope is the thump or beat to let you know where the blood pressure is. The first beat that you hear is the systolic blood pressure, or the contracting of the heart. The last point where you hear the beat would be the diastolic blood pressure, or the relaxation area of the heart. So, we're going to now demonstrate how to take the blood pressure. I'm going to have my assistant, Tish, come help me, please. And like I mentioned, earpiece in, cuff position in the right area over the brachial artery, chest piece on the brachial artery, pump up, deflate, listen for the systolic and the diastolic pressure, and take off. Now we have just taken Tish's blood pressure. Thank you, Tish.
No problem.
In this speech today, I have defined blood pressure, explained the components, and then demonstrated how to take the blood pressure. These small steps can help indicate what issues that are underlying that could lead to other problems in health. I hope today that this may help someone and maybe preventing the loss that I have had in my life with high blood pressure and family members. Thank you for your time, and that is it. Question and answers, anybody? Somebody ask me some questions? Yes.
How cool is it outside?
Any other questions, anybody?
What's the normal range for blood pressure?
Well, that can vary. Textbook is 120 over 80, but the AMA puts out it could be anywhere from 120 over 70 to 118 over 60. So it just depends on what the association comes up with.
So it varies from association to association.
Yes, and it varies from person to person. Some people blood pressure could be 140 over 80 and that's normal for them. Whereas some of them can be 118 over 60 and that is normal for them. So each person will have a different blood pressure. Any other questions?
Thank you.
Okay, thank you.